Hello viewers, my name is Regina Mwangi. I'm a counseling psychologist from PCEA Gateway Parish. I am representing the Health Board, and in the last 2 weeks we have been having a discussion concerning the issues that have come up as a result of the COVID-19 crisis that we have found ourselves in. 2 weeks ago we spoke about how to manage change, and we talked about the challenges that come with that have come with these changes with the coronavirus, and some of the challenges that people have been facing. And we also talked about the various stages of change, and how to manage and how to navigate through those changes. We talked about the initial stage where someone would receive news and be stuck in the status quo, in shock and denial, and not knowing whether to go or stay. And we also saw that when COVID-19 came around, all of us were not prepared. No one was prepared. It's something that has never happened to us, and so we have been going through those changes through the status quo, but moving on from there to the next stage, where some people developed fear, others anger, others anxiety, because there were a lot of disruptions, and they continue to be. The disruptions have continued to happen to a lot of people. But we also talked about the movement from the disruption stage to the exploration stage, where many people now have come to accept the new reality and are adjusting. They are adjusting their lives to suit or to be able to navigate this whole new way of life. And then, of course, from there, from accepting that, there's a movement to rebuilding our lives, moving forward, learning how to live with ourselves in this new era. And we also said that these stages are not necessarily linear, and we realized that it's sometimes possible to find yourself moving forward and finding yourself also moving backwards once in a while, and that's okay. That can be expected. The most important thing is to ensure that we do not get stuck, that we do not remain in a stage where we are not moving forward. But if anyone may find themselves not able to move forward for one reason or another, because that can happen, it's important to ask for help. It's important to ensure that you're able to move forward in a positive way, and there is help available. So we looked at that in 2 weeks ago. Last week we talked now about some of the mental issues that have come up as a result of those changes. And we talked about fear, anxiety. We talked a little bit about how families are getting challenged as a result of the movement restrictions. And we had some two gentlemen who talked a little bit about some of the challenges the men are facing. And we also heard about how they are able to navigate some of those challenges. And we were encouraged, and we would encourage you to speak to one another, to speak to your family members, so that you're able to move forward. Today I would like us to talk about some of the challenges now that families are facing in the context of living in a way that we have not been used to living. Governments across the world have put in measures to try and diminish the contagion and to lessen the burden on the healthcare systems. And some of those restrictions have been difficult for most of us. We are aware that we are not able to move about the way we are used to, and the restricted movements have affected people in different ways. Why is it so? One of the reasons this is a challenge is because we are not used to staying under one roof. It's very rare for a whole family to be under one roof 24/7 for weeks on end, and that has created a bit of a challenge, and conflicts are rising. We have heard of families where there are a lot of conflicts, and this is because this is something we have not been able to, we have not experienced before, but we will look at how we can manage some of those challenges. One of the reasons why this is so is that we have to remember that human beings are social beings. Research has shown that people who are socially active more than those who are not, have higher levels of physical and psychological well-being. And therefore, when people are restricted in their social interactions, this has created quite a bit of stress, and it's not sitting well with people. The other reason is that in periods where human beings face difficulties, the natural tendency is for us to seek help from each other. We seek to interact with others in solidarity, trying to to just share experiences, to help one another, and we do so by actually meeting and meeting physically and interacting and just being there for one another. Now, these restrictions have done the exact same opposite, because being asked not to interact, as much as it is absolutely necessary for our well-being, we are being forced to do the exact opposite of what we naturally do, and of course this has had its negative consequences for most people. The other thing is that stress and fear that has developed as a result of this unknown enemy, this invisible enemy called COVID, creates a lot of paranoia, because people are not sure what to do. But when we look at people are not sure, they are not certain what to expect next. But why is it then, when we look at the family, in the family setting, why is it that a lot of conflicts seem to be building up at this time? Like we said, the first issue would be, it's not common for us. We have not been spending 24 hours, 7 days a week, weeks on end, under the same roof with the family members, as much as we care about each other and we love each other. So that has created its own challenges. The second reason why conflicts may be arising is because we have different needs. Each member of the family has different needs, and that has happened. That, of course, occurs because we have different personalities, and we are also in different stages of our lives. Within a household, there are older people, the parents and the grandparents if they live in the same household or if they are living together, and the younger people. Someone of a different age group, maybe a parent, may require peace, a quiet time, in order to stay calm, in order to experience their calmness. Maybe that's how that's what they need. But the younger people may actually be needing the opposite. They may feel, I need to listen to music, and I may actually need to listen to loud music. That's the way I am going to relieve stress. And so these two people, they are in the same house, there is going to be conflict. So different needs are going to create some bit of conflict, unless, of course, we are aware of it and we try to mitigate it. One of the other reasons why there are conflicts within the family is because a lot of people are not able to access their coping mechanisms. They are not able to reach out or to get to places or activities that they use as their coping mechanisms. So, for instance, if someone relieves or gets rid of their stress by going to the gym, now that is a challenge because you will not be able to get there. There are those who engage in sports. There are those who engage in, maybe they are particularly ladies, there's a lot that happens when we meet for chamas. We are able to talk and laugh and share experiences, and because this is not happening, that is now creating, that is going to bring a lot of conflicts, because the tension is rising within us, and sometimes we let it out in negative ways. They are also within a household, we also deal with stress differently. So we cope differently. There are those who cope by, there are those who have to talk. For their way of relieving stress is talking. I want to talk. That's the only way I'm going to relieve the stress that I'm feeling. There are those who require quiet. They withdraw to themselves, so that's how they process it. That's how they deal with it. Now, these two people being in the same household, if they do not understand this, if they don't understand and respect this, then there's going to be conflict. So, among other things, other things that would cause conflicts in the family. Those are just a few. But then it's important for us now to look at how then can we minimize, if not get rid of, some of these conflicts, or how can we work around them so that it's not a constant way of life, you know. So one of the things that we need to bear in mind is that it's important for each individual to manage their fears and anxieties. Manage what it is that you fear, and how do your fears and anxieties, particularly concerning the pandemic, as we I mean, whatever it is that this thing that we are experiencing. And we can do this first by doing what we already know. You know, just take care of yourself. Do what it is that is required of us to be able to stay healthy and to minimize or eliminate altogether the chances of us getting the disease. So that will take care of a lot of the fears that we may be experiencing. And so that means even the intensity of our social interactions, we need to manage that, and that will take care of a big portion of what we are fearing. It's also important to take care of ourselves physically. Physical exercise is really important. It's important because when we are physically fit, when you are physically okay, a lot of stress just disappears, you know, a lot of stress. And that when we do not have much stress, or when we are able to live stress-free, then a lot of other areas of our lives will work well. And there's a lot we can do about physical exercise. It doesn't mean you have to go to the gym. Most people don't even like the gym anyway. But you can just walk around your compound, if you can do that. Walk around your area. You can, within the home, you can do a lot of physical work. You can help in the chores around the house. That's physical. You know, that's physical exercise. You are exerting yourself. Taking care of a lot of stuff around the household, because we have more time than we have had before. And doing anything that you feel is making you're really using a bit of energy. So physical exercise is important. The other thing that we can look at is, it is important to understand how you feel. How are your feelings? How do you feel, and how do you manage your feelings? Are you managing your feelings in a healthy way or in a harmful way? Because it's important to understand that. If we are not managing, or if you're trying to manage our stressful feelings or our tension in a harmful way, for instance, if we turn to alcohol or substance or whatever, that's not going to work, because eventually it will catch up with us. It's not really helpful. So it's important to understand how we feel, and then once I understand what it is that I feel, then it's important then to know how can I make myself feel better. And once we are able to do that, it's important to share that or to communicate that with the people that we are living with, so that they're aware. So when we do that, it works. It will work to a certain degree. Because if we don't understand how we feel, we don't understand why we feel the way we feel, then we will not be able to do much about it. And we will not, the other people around us may not be able to help us. The other thing is that it is important also to communicate your needs to the others. What does that mean? It doesn't matter whether you've lived with your family or your life. Don't assume that they know what you need. Don't assume that they know me, I mean, this is my family. Just tell them what you need. If you need quiet time, just say that. If you need to talk to someone within the family, if you need some help in a certain area, just communicate. Communicating is important. And then the next point is almost like the same, but this involves boundaries. It is important to create boundaries if they are not already there within your family, and negotiate around those boundaries so that everyone is accommodated. So what am I talking about? There's a lot that happens within the home, and when you have boundaries, and I'm thinking about families where there are certain members who are working, who are doing their office work at home, and yet you're within the home. There's all this going on around the home, so it's important to negotiate. What is my office time? What is the family time? How are we going to share the chores that need to be done? What time do we need to come together to talk as a family if we need to do that? If there are things you do together, if you eat together, it's important to share all those and to negotiate those boundaries so that everyone is aware of them and everyone is able to respect that. And then thinking about the conflicts that have been happening quite a bit in most homes, it's important for us to choose the battles. It is not every battle is worth fighting. If you notice that whatever may be causing conflict is really not worth much, sometimes it's just good to avoid it. It's good to avoid it. One of the things that cause us to pick fights or to fight with one another are simple things like just whatever is happening around the house. For instance, if I am not happy with the way my sons are leaving their rooms untidy, they are not making their beds, for instance, that can easily escalate into some conflict or some arguments, which are going to leave everyone feeling bad and feeling tense and feeling more stressed than we already are. But it's also important to communicate in a way that is not confrontational. For instance, I may just say, instead of asking them, why are you not making your beds? Why are your rooms like this? It's very easy to ask the same question or to come around this or to talk about the same issue by expressing it as a wish. So for instance, I can simply say, it would really be nice if you could just make your beds and leave your rooms a little bit tidy. It makes it easier for everyone. Now, that is saying the exact same thing, but in different ways, and it will most likely eliminate an opportunity for war or for conflict. Now, the other thing that we need to remember, as a family, it's important for all of us to take care of our mental and our psychological well-being, just to take care of how are you feeling, even talking to each other, and also looking out for each other. For instance, you know one another best. So if one of you is feeling a little bit low, it's easy for other family members to pick out or to pick that up. And it's important just to find out, how are you feeling? Because every day is different. Each day is different from the other. I may be okay today, but tomorrow I may wake up feeling really low and apprehensive and fearful. And it's important for us to look out to each other so that if there's a member of the family who may be more the other point I would like to point out is it is important to connect with someone who makes you feel good. it can be a member of the family within the whole household that you're living in, but it can also be someone else, maybe a family member who's not there, but it can also be a friend. Just one person. Connect every day. Try and connect with one person who makes you feel good about yourself. And this may be someone who encourages you, someone who comforts you when you're low, someone who challenges you when they feel you're not giving your best. This is someone you're free with, someone who you know you can be yourself with them. But it has to be someone who leaves you feeling rejuvenated and good about yourself. That is important, and we can do this by phone. These days, it's not hard to call someone who is as far as the farthest part of the globe, but that's important. It's important to do that. The other thing I would like us to probably think about is trying to see the positive in this situation that we find ourselves in, and we will do that by looking at your own life, your own household, your own family, your own space. Why do I say this? Because in a time like this, it's very important. It's very easy to just focus on the negative. It's easy to look at what we are not able to do, where we are not able to go, what we've lost. But in every situation, we must remind ourselves that there's always something positive, and if we look for the positives, we will find them. The fact that we even have time to be together as a family. There are some families that have never really had time to be together for such a time, for as long as they have been together, or even have that time. And that's a good thing, because you will learn about each other. We are able to share experiences probably we never shared before. And there's a lot of good going on with us. One of the things that I like to do for myself when I'm tempted to feel negative and to feel to feel self-pity or anything, I usually just take a page and write all the things that I'm grateful for, all the things that are positive about my life. And I look at my life, I'm alive, I am healthy, I have a family, I have friends, I have a church that I know takes care of my spiritual well-being. I have everything that I really need, to be honest, because a lot of things that we think we need, we don't need. But my point is, if you take a page and just write the things that you're grateful for, by the time you are done, because first of all, you can't write everything, but by the end of it, you will not even be remembering most of the things you do not have. So let's look at the positive in all these things that are happening. And that also, remember that it's not going to last. I mean, we will not be in it forever. There's a saying that whatever has a beginning has an end. One of the other things that we can learn during this time as families and even as individuals, so we can learn it individually, we can also learn it together as a team, is to learn new things that we have not learned before, skills that we may never really have acquired before. I have heard of people who have started to do stuff that they're actually making money out of. There are some people who had hobbies that they forgot, and they're going back to them. So there's a lot that you can do. You can fix something that has not been fixed around the house for long. You can learn to bake, you can learn to knit if you're a lady and you are interested in it. And some of these things you can actually make money out of them. You can bake and sell, you can knit and sell stuff, or give out warm things to people who need them. So there's a lot that we can learn. There's also other things that we can take advantage of. Technology is here with us. I mean, we can take advantage of it. You can learn a skill like high-speed reading, for instance. You can enroll on a course online and learn something that is not even related to your field. And I can tell you that some of these things will come in handy maybe later on, but just making use of the time and the resources that are available to us. Let's do that. And that, first of all, will take care of some of the extra time that we have on our hands, and it will enrich us. Okay. As we all know, we are spiritual beings, apart from being social beings, and we have many parts. I mean, we are human beings, but we have a social part, relational, interpersonal, mental, but we also have a spiritual part. Part of us is spiritual. The most important part of us is spiritual. It's important for us during this time to really take care of our spiritual well-being. Whatever it is that you do to ensure that your spiritual well-being is taken care of, it's important not to neglect that. When our spiritual well-being is taken care of, a lot of other stuff just fall off. A lot of other negative things happening around us fall off. A lot of fears just fall off. A lot of anxieties, a lot of stuff that is negative usually will fall off when we take our spiritual well-being seriously. So I would encourage all of us to do that. And during this time, I have also heard and seen that families now are having fellowships at home. Some families have never done that, and it is really enriching their lives. So maybe this is a good time to introduce a family fellowship for you as a family, and just to learn to grow together spiritually. We cannot forget to take care of our, to prioritize self-care. That's the other point that I want to say or to make. And self-care is all-rounded. Your spiritual, social, physical, mental, everything, emotional, everything about you. Do something every day, for instance, just to ensure that you're taking care of yourself. As part of self-care, your self-care regime, just do something every day. And sometimes this may need to be a deliberate effort on your part. Do something every day that makes you feel good about yourself. Something. It doesn't mean 2 or 3, whatever it is. At least one thing that makes you feel good about yourself. And it can be anything. It can be reading. There are those who feel good about if they walk, if they exercise. That's one of the things that make them feel good. Others feel good when they talk to someone in their lives. So whatever it is, take care of yourself. Just ensure that you're taking care of yourself. Self-care is important. And before we finish, I would like to say 1 or 2 things to parents because of the children. When crises come, like a crisis like this comes, it's I don't know why we forget children, and we sometimes forget that they also have needs, they have feelings, they know that something is going on, and sometimes we neglect them. So to parents who have children in the house, regardless, particularly the younger children and teens, and maybe younger than teens, at a time like this, they are aware that there are changes that have happened. It's important that you assure them, assure your children, reassure them. Just make sure that they're not overly worried or overly anxious, because remember, their routine has also been disrupted. Those that have been going to school, they're not going to school. Some of them are too young to understand why, but there are those obviously who know there's a disease that's going on. But just reassure your children and ensure that if they have questions, that you're able to answer them as honestly as possible, without necessarily raising their levels of anxiety. But also making sure that whatever is going on is going to come to an end at some point, but you're there for them. It's important, so reassure them. The other thing is, it's important to lessen media or the news that is available. Sometimes it's not wise to let every news item be exposed to your children. Limit that, and whatever it is that they need to know, if they have questions, for instance, of course they'll have questions. Just use the language that they understand, depending on their age. An age-appropriate language, just use it to get them to understand what is going on, and to continue to love them, and when they show anxiety, because some of them will show anxiety and they may it may look like they're acting out in negative ways. Instead of punishing them or berating them, it's important to love them. It's important to show them extra love during this time as a part of reassuring them, but make them understand what's going on in a language that they understand for their age. Have fun together. Have fun together. Remember, your children are not able to go and interact with their schoolmates or even their neighbors. In some cases, they are not able to go out the way they are used to. And so find ways to have fun with your children. Play with them, read stories with them, jump up with them, just have fun with them. It will be a time for connecting even to deeper levels, and also helping them to cope with whatever negativity they may be experiencing from other quarters. So help them in that way, have fun together. The other thing is, as families, members, and as households, let us ensure that we get the help that we need. If among us we notice that some of us are not doing so well, I know I have mentioned this before, some of us may not be coping as well as we should, regardless of the help that is available within the family, just reach out to someone, reach out to a professional who may be able to help this person. Change is always very difficult, and this is a major change for everyone. So reach out, because help is available all around us, and you'll be able to get help. It may be therapy, it may be coaching, it may be education that you need. Maybe you need to be educated about a certain aspect. You just need information, and or you just need help. Remember, there are some of us who, when this thing happened, they were already grappling or they were already going through certain mental health issues, and this has become now even more difficult. And for such people, do not neglect to find help for them if they are within your family. So families are there for one another. So finally, before we end this, I just want to reiterate something that I heard from Dr. Michael Ryan. This is the World Health Organization. This is the guy who is in the health emergency program in the World Health Organization, and he was saying, whatever is going on around us, it is up to me as an individual, it is up to you as an individual to take care of your own risks. You focus on your own risks. We focus on our own risks. And we are getting a lot of information, correct information from the right sources. But at the end of the day, it boils down to me and to you and what we do with this information. So doing the right thing, being in the right, making the right decisions, getting this information in order to make the right risk-based decisions. The same way, we make risk-based decisions on a daily basis. That's what enables us to avoid risky situations, because we can see, we can look around, we know something. When you're crossing the road, you look around to see, is it safe? That's a decision you make based on what the information that is around you. And so even during this time, let us do what we need to do as individuals, and protect ourselves, protect our families. And if we do this on an individual level, at an individual level, on a daily basis, then this makes sure or ensures that as individuals we are healthy, our families are healthy, and the community is healthy. So it is not a government thing. The government is there to help us with the resources that are available and to give us the right information, but it comes down to individuals and the decisions that we are making. And if we do this collectively, then our society is going to be safer, and it's going to be good for everyone. So by ending this, I want to remind all of us to do what we are supposed to do, continue keeping ourselves and our environments clean, washing our hands with soap and running water whenever possible, however many number of times we need to do that. That's a decision also you make. Wearing our masks when we are in public places, just taking care of ourselves and taking care of each other. And that way we will beat this thing. In the long run, we will come out victorious. So I wish you the very best. I hope that we will continue to seek help where we need help, and that none of us will be left behind in our way, in our moving forward in this new reality.